Well, good morning, everyone, and welcome to Whitmix's Tuesday morning webinar series. This morning's webinar is entitled The Three-Step Model to Growing a Dental Sleep Medicine Practice. My name is Bernie Jaroslaw. I'm the marketing manager here at Whitmix, and I'll be facilitating this morning's webinar. So I'd like to begin with a few housekeeping items. The first, in the upper right-hand corner, you should see a questions box. Feel free to type in any questions you might have throughout the presentation, and we'll make sure that those are answered. Mark will answer those at the very end of the webinar, not during. Next, if you are a CDT or a dentist, this webinar is approved for 1 hour of CE credit towards your recertification. You'll receive an email within 1 to 2 days that will tell you exactly how to obtain that credit. It's pretty easy. It does involve a little short and easy test. So listen carefully. Lastly, the webinar is being recorded, so within 24, sometimes up to 48 hours, it'll be up on the Whitmix website in the webinar section. So if you want to rewatch it, you can check it out to answer questions on the certification test. That's up to you. This morning, I have the pleasure of introducing Marc Fowler. Marc is CEO and founder of Bullseye Media. The website is dentalsleepmarketing.com. He'll share the proven three-step model to effectively grow a dental sleep practice. You'll see examples of successful dental sleep marketing strategies, and you'll learn how to take your sleep practice to the next level by effectively reaching sleep patients where they are with a message that resonates with them. Whether you're just getting started in sleep or you've been treating sleep patients for years, you'll gain valuable insights that will put more sleep patients in your chair. And Marc will also be answering the most commonly asked questions about direct-to-patient dental sleep marketing. So that's about all I've got, Marc. So if you're ready, let's talk about growing a dental sleep practice.
Perfect. Well, thank you very much, Bernie. All right, so we're going to walk through a three-step process to effectively brand and position your sleep practice for success, as Bernie said. And I'll also be showing you examples of what's working right now for successful sleep practices across the country. But before we jump in, I thought it might be helpful just to give you a short overview on my background as it relates to marketing and sleep apnea. I received a marketing degree in 1992. I spent the next 14 years working in marketing and business development for 2 Fortune 500 companies, and then later an Inc. 5000 Silicon Valley technology company. Founded Bullseye Media in 2006, and within a couple of years, we were working exclusively with dental practices, helping them with websites, branding, digital marketing, etc. Then about 5 years ago, while doing research and writing content for a client of ours who wanted to focus on treating patients with sleep apnea using oral appliance therapy, the light bulb went on, and I realized that I had many of the symptoms that I was reading about. And as I kept reading through these and doing the research, I realized all of those things: waking up exhausted after sleeping for 8 or 9 hours, poor memory, bruxism, acid reflux, etc. All of those, I was experiencing all of those symptoms. And over the past 5 years, I've researched the topic of sleep apnea. I've interviewed dental sleep experts, attended countless lectures on sleep disordered breathing, and have personally used CPAP, 3 different oral appliances, a combination CPAP oral appliance device, a tongue stabilization device, and also had nasal surgery. So I am all in on the topic of sleep apnea, both personally and professionally. And I'm excited to be able to combine my love of marketing and my personal experience with sleep apnea and share some things with you over the next 55 minutes that I hope will enable you to treat more sleep patients, literally saving lives, and in the process create a sleep practice that can either be a profitable complement to your general practice, or perhaps, like many of our clients, allow you to sell your general practice and focus exclusively on sleep if that's your goal. So let's see. So let's talk about the market potential. When it comes to the potential with dental sleep, you've probably heard the statistics. 1 in 5 adults has some level of obstructive sleep apnea. about 80% of those are undiagnosed. CPAP has a failure rate over 75%. And today, the statistics I've heard indicate that oral appliance therapy only makes up about 10% of the obstructive sleep apnea treatment market. So a lot of potential for growth. And as a dentist, you are the best positioned healthcare provider to educate, screen, and treat this epidemic. And most of your patients, if you think about it, they see you more often and spend more time with you than any other healthcare professional. And unlike every other provider that's treating sleep, you're able to offer an alternative to CPAP. Let's look at some data that'll further illustrate just how great the potential is for you as a dentist treating sleep apnea. So listed here are 7 popular dental services that tens of thousands of dentists chase after in their marketing and their advertising every month. And here are the average number of monthly searches that take place on Google for each of these services. As you can see, these 7 combined generate a little over 295,000 searches each month on Google. And here's how much it costs to those dentists who are bidding on those terms and advertising on Google. Here's how much they pay each time someone clicks on their ads. Okay, so an average of about $8 per click. And this final column shows how competitive those keywords are, with 100 being the most competitive. And keep in mind that most online advertising platforms, such as Google, are auction-based systems. So the more practices bidding on a keyword term, the more expensive the cost for each click. Now, let's compare that data with the data for sleep apnea. First, you'll notice that there are actually more Google searches each month for sleep apnea than all 7 of those other services combined. Next, you see that the cost per click for sleep apnea at a little over $2 is a fraction of the cost of the average of those others. And then finally, the competitiveness for sleep apnea is significantly less. And the bottom line is there are a lot of people searching for sleep apnea solutions. The cost to reach them is comparatively low, and there's less competition for it than most other dental services. And that is the definition of an ideal target market or niche. You literally could not create a better scenario than that. There was a popular business book that came out a few years ago called Blue Ocean Strategy. And the premise of the book is that businesses can succeed by creating blue oceans of uncontested market space, as opposed to doing battle in what they call red oceans, where competitors fight for dominance. And the analogy being that an ocean full of vicious competition turns red with blood. So the idea is you want to find those blue oceans where there's less competition. And dental sleep is the blue ocean in dentistry, at least for now. As more dentists realize the potential with dental sleep, it'll get more competitive, just as we've seen with other lucrative dental services. But for now, there is a window of opportunity for those practices, those dentists who embrace it and go after it. And while every other dentist in your market is fighting it out, chasing implants and cosmetic procedures, saying the same things to the same audience, and continuing to drive up the cost of the advertising, again, there's this window of opportunity to target dental sleep patients. And as I said, the potential, as we saw, is great for dental sleep, and the time to grab market share is now. And I'm going to walk you through a blueprint that'll help you tap into this potential. Having worked with dozens of dental practices, from those who are just getting started treating sleep to some of the highest producing sleep practices in the country, it's become evident that 2 things are required in order to maximize the growth of a dental sleep practice. Number 1, you must have an effective direct-to-patient marketing strategy so that you aren't dependent solely on referrals from physicians. Many dentists who get involved in sleep are told, hey, if you can just get some local physicians, some ENTs, some pulmonologists, etc., to refer you sleep patients, you'll be all set. However, it can take years to develop those relationships. And even then, the referrals can be sporadic. And those dentists, even those who have been at this for years, and have a strong referral network already built up, they still utilize direct-to-patient marketing in order to diversify their new patient sources. And then the second thing that became clear that is necessary for success and to maximize the growth of a sleep practice is that you need a brand identity for sleep that is separate from your general dental practice. Okay, and there are a few reasons for that, that brand identity is important. First, you need to position yourself in the minds of prospective patients as the expert on the topic of sleep-disordered breathing. And you want to accomplish that by simply adding a page about sleep to your general dental practice website. That won't provide proper positioning or put the patient in the right state of mind. When a patient comes into your office for a sleep consultation, you want them in a medical, not a dental mindset, because you'll be talking to them about treating a medical condition and billing medical insurance. And if you think about the typical patient-physician interaction, a doctor walks in, asks a few questions, conducts a quick exam, and starts writing out instructions. There is no case presentation. It's simply, I want you to take 20 milligrams of this twice a day, have these tests done at this lab, and come back and see me in 2 weeks. And what do most people do? They do exactly as instructed. And that's the mindset you want them in when they come to see you for that sleep consult. Additionally, your website must instill confidence and establish you as the go-to authority on the topic. And if your website is trying to be all things to all people, it can actually have the opposite effect. Let me show you an example of this. A little over a year ago, I was in the middle of a real estate transaction that became more involved than I was comfortable with. And I realized I needed to find a real estate attorney. Since I didn't know one, I did what most people do in that type of situation. I did a Google search. And here are the results that came up. And this listing caught my eye, probably because it had the 5 stars showing. And their website's title tag, you see there in blue, says real estate law first thing. So I clicked on it. And this is the page I landed on. And right away, I'm thinking, that's strange. Their page about real estate law says employment litigation and OSHA defense in the header. So now I'm wondering if real estate law is just an afterthought for them, and they're actually really employment lawyers who happen to do a little real estate work on the side. So I went to their practice areas or services page, and I saw this long laundry list, and I kept scrolling down the page, and finally almost at the bottom it mentions real estate. And these other services are so unrelated to real estate, and the laws are so complex for each, it made me wonder how they can possibly be experts in real estate law. And that saying, jack of all trades, master of none, came to mind. So I moved on, found another attorney. Now, let's think about this concept from a patient's perspective. When a patient gets to the point of seeking out treatment for sleep apnea, they're often desperate and frustrated, and they want to find an expert to provide a solution. Okay, so let's imagine a patient in Chicago doing a search for sleep apnea treatment. And here are the Google search results for that search term. And you notice that result at the top of this page, Smile On Dental Salon and Sleep Apnea Center. We also offer root canal treatments. Now, reading that, there's probably a percentage of patients that may wonder what root canals have to do with treating sleep apnea, because they're already probably confused enough trying to get their mind around the what and the why of sleep apnea and all the verbiage around it without throwing them that curveball. And if they do happen to click on that listing, they're taken to this website, and the confusion and mixed messaging continues. You can see along the top, they have dental services, sleep apnea, and Botox. Then hovering over dental services shows this whole list of services. And at that point, that potential patient may be thinking, wow, they sure do a lot of stuff, and much of it's unrelated. And we're back to the jack of all trades feeling like I had when I was on that attorney's website. Just as it was difficult to see how labor law relates to real estate law, it's equally difficult for a prospective patient to see how dentures or Botox relate to treating sleep apnea. It's easy to make the connection between root canals and crowns. It's next to impossible to make the mental jump from root canals to sleep disordered breathing. Also, keep in mind that with traditional dental services, you're only competing for patients' attention with other dentists. With sleep apnea, as you'll see from this example, you're competing with a wide variety of healthcare providers. And these are just a few of the results that come up with the search Sleep Apnea Treatment Houston. You have a local hospital, an ENT, a neurologist, an oral surgeon, an association, and a sleep lab. So you really need to be sure that when your listing shows up in a search like this, there's nothing that would cause confusion and prevent a potential patient from clicking on your listing. Let me show you what I mean. Here are two of the listings that show up for that Sleep Apnea Houston search. Now, a question for you. For a typical patient conducting this search, which of these two do you think they'd be more likely to click? schultzsmiles.com/sleep-apnea-snoring or houstonsleepsolutions.com. They're both dentists. The difference is that Houston Sleep Solutions avoids any potential confusion because they've created a separate website and brand identity for sleep. So with these ideas in mind, let's look at a three-step strategy to building a successful direct-to-patient sleep marketing program that positions you as the expert and enables you to be found by prospective patients. And the first step, really the foundation, is your brand. And for all the reasons we just looked at, you need a sleep brand that is 100% independent of your restorative practice brand. And we're going to walk through each of the key pieces of building your sleep brand. First is selecting a name for your sleep practice. And ideally, the name will contain the word sleep. And for the reasons we just covered, I don't recommend having the word dental in the name. Okay, for all of the branding reasons we just covered, also when the average person hears dental sleep, they think sedation, not sleep apnea treatment, okay? And so once you've decided on the name, the next step is you'll want a professionally designed logo. And your logo should be clean, easy to read, and have a visual element that supports the fact that you're offering a solution that helps people breathe better and sleep better. And next is a standalone website that is 100% dedicated to sleep breathing disorders. In other words, it's an entirely separate website from your general dental website. When a prospective sleep patient lands on your website, it needs to give them exactly what they're looking for because people are impatient online. Don't make them have to search for the information that they're seeking. Okay, in this example, as soon as they land on the homepage, they see snoring affecting your relationships, tired even after a full night's sleep, and they're thinking, yep, exactly. And that's speaking their language right up front as soon as they land without them having to search. And this is actually a video that plays in the background that's designed to really speak to her in this case, because let's face it, she is more likely to call and schedule a sleep consult for him than he is. You want your website to make people say, that's me. That's exactly how I feel. That's what I'm experiencing. And professional copywriters call this joining the conversation that's going on in the prospect's mind. Everyone has an internal dialogue going on at all times, and that sleep apnea sufferer is going to have a very specific conversation going on. And you want everything from the imagery to the verbiage to the user experience of your website to join right in on that internal conversation that they're having. Your website has three main goals. First is to educate, next to establish trust, and finally to convert, with that third being most important. You want to get them in the door, convert those website visitors into scheduled appointments so you can treat them. So your website needs to be informative. So for example, here they're seeing the health issues, right? The comorbidities related to untreated sleep apnea, which gets their attention, starts to establish the fact that this isn't simply an inconvenience, It's a life-threatening disease. In fact, I read that untreated severe sleep apnea reduces life expectancy by an average of 12 years. So you don't want to sugarcoat this. This isn't one of those, you really should consider doing something about that. I mean, this is you must address this immediately. Okay, you want to create that sense of urgency and help them realize how serious this is. This isn't one of those optional cosmetic procedures. Then you get into symptoms. Again, you're educating them, starting to tie things together. Gets them thinking, maybe that's why I've been having those headaches in the morning, and every time I go to see my doctor, they tell me my blood pressure's high, right? They come to this interactive quiz, and they're going through checking these off. Yes, 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 that's me. And now they're engaged, which is what you want. As part of that educational piece of your website's objective, you also want to answer their questions and be a resource. And additionally, you want to anticipate possible objections and address those. And a question and answer format is ideal for doing that. And this is a big one. If you offer home sleep tests, you want to make that prominent on your website. A lot of people aren't willing to go to spend the night in a sleep lab. And by letting them know that you offer an alternative, you're removing that objection. And if you're referring sleep patients out to a sleep lab or a sleep physician who sends them to a sleep lab, you're definitely losing patients, and a high percentage of them will not end up receiving treatment from anyone because they never go through with the in-lab sleep test. I know for me personally, if home sleep test hadn't have been an option, I probably still would not know that I have apnea because I just can't picture myself going and spending the night in a sleep lab. So this website has been looking at kind of walking them through a journey, if you will, kind of telling a story, taking them from start to finish. And you want to show them the happy ending. You want to bring them full circle and paint the picture of what life could be like and give them hope. Because like that first one, their restful sleep, wake up feeling refreshed and rejuvenated. As a sleep apnea sufferer, they have never, or at least they can't remember, what it feels like to wake up refreshed and rejuvenated. Mornings aren't something they look forward to. So you need to, and this isn't something that they will naturally come to that conclusion. You want to really paint that picture for them. Okay? Because remember, the primary goal of your website is to get them to schedule that consultation so you can sit down face-to-face with them and educate them and explain the advantages of oral appliance therapy and actually show them an oral appliance, right? And again, helping them visualize a positive outcome will increase the likelihood that they call and schedule that consultation. And since the ultimate goal is to get them to schedule, you want to let them know exactly what to expect if they do. So this is, you want to have a section like this, use it as an opportunity to overcome any hesitation, any fears they may have, and make it very clear throughout the website that the proper course of action is to schedule that consultation. Okay, and the next piece in building a sleep brand is a Facebook page, a branded Facebook page for your sleep practice. And this needs to be separate from your general dental practice Facebook page. And there are a few reasons that Facebook's important. First, many people use Facebook as a search engine. So you want to have a presence so you can be found for sleep-related searches. Also, Facebook pages will often show up in Google searches for various search terms, so it increases your visibility on Google. Also, Facebook is one of the 3 most important review sites along with Google and Yelp. And finally, a lot of people simply expect businesses to have a professionally designed active Facebook presence. Now, when I say active Facebook presence, don't think that I'm saying that you need to post to your Facebook page every day. Once a week or even every other week is fine. You just don't want to go months without any activity. And then I'm always asked, what type of content should we be posting to our Facebook page? The ideal content is personalized. So photos of you, your staff, your office's involvement in community events, charitable, anything like that. So that's the main thing that we encourage. Then you want to supplement those posts with additional content. At the request of several clients, we created a social media library, and we have about 550 custom designed posts in there. It's, copy and paste posts. But let me give you a few examples from that library of the type of content you want to be posting to your Facebook page. You want to post sleep-specific posts like these, okay, as you would imagine, and these, just creating awareness, getting them interested enough to visit your website for more information. However, even on your sleep practices Facebook page, you don't want to only post about sleep issues. You want to mix it up and keep it interesting and engaging. So you can include inspirational quotes, jokes, trivia, holidays, etc. Okay? And then the final piece of that core branding foundation is a YouTube channel. YouTube is the second most utilized search engine after Google. So you want to have a presence on YouTube so that you can be found when prospective patients are using it. In addition to showing up in YouTube searches, remember that Google owns YouTube, and they tend to give YouTube videos special treatment in the Google search results. And in addition to individual videos showing up, giving you increased visibility, your YouTube channel itself will often show up in Google searches. So having these elements in place will not only create a professional sleep brand that positions you properly in the minds of sleep patients, but let me show you another advantage of having those particular branding pieces. So shown here are the top 5 websites in the US, okay? Those websites that receive the most visitors, the most traffic. So Google, Facebook, YouTube, 1, 2, and 3. Having and optimizing those branding elements we just looked at, your sleep practice will have a presence on the top 3 busiest websites. Okay? The sleep website we talked about is optimized to be found on Google. The sleep branded Facebook page is optimized, obviously, to be found on Facebook. And it'll also, as I said, often show up in Google searches. And then the YouTube channel provides a presence on YouTube, as well as an additional opportunity to show in Google searches. So I'll pause here for just a minute. If you've already heard enough and you want to talk specifics about your practice or your particular market or ask specific questions, you can wait till the end. We're gonna do that. We're gonna have an opportunity for Q&A at the end here, but you can also schedule a one-on-one consultation with me if you'd like to do that in addition. You can visit dentalsleepmarketing.com, just click on the blue button, and that'll take you to my calendar, and you can select a time that works for your schedule, and you can bounce questions off me, we can brainstorm with you about your particular needs, your market, etc. All right, so on to step 2. So with those core branding pieces in place, the next step is to build out supporting marketing assets, okay? And that will increase awareness and expand your digital presence, enabling you to be found by more sleep patients. Okay, and one of the most important assets is what's called a Google My Business listing, often referred to as GMB listings, and that's what I'll refer to it as GMB from here on out. Right under the ads on the first page of a Google search result is something called the local pack, and I've added a red box around it here to make it stand out so you can see. So this is prime real estate on the Google search results page, right there at the top. And the only way you show up here is by having a GMB listing, okay? And with very few exceptions, your general practice's GMB listing will not show up in this local pack when someone conducts sleep-related searches. So you need to establish a separate GMB listing for sleep. And your listing must be fully optimized. You want to fill out every section, address, phone, hours, etc. And your listing needs to be linked to your sleep website. Okay, be sure and upload several photos to your, your office, the doctor, your team. Those photos are going to help you become more visible, get you more clicks, and show up better in Google. And Google also allows you to upload videos into this section. And the advantage of video is this video audio plays, so it really grabs attention. And then you'll also want a well-written, keyword-rich description about your sleep practice. And then ideally, you want to gather a few reviews from sleep patients. Okay. So another great way to enhance your listing and get a lot of additional visibility is to add what are called Google Posts. And posts are almost like an ad or an announcement. They allow you to highlight a service or offer or some upcoming event. And these posts will show up right in your Google business listing, and they can be still images or videos. And as you can see, they can receive a lot of views, a lot of activity, and you're not paying for those views or any clicks from these posts. So this isn't paid advertising, but it's just a great opportunity to get a lot of additional visibility without paying for it. And Google has been giving the local pack more and more importance. So these GMB listings can generate a lot of phone calls. We create a tracking dashboard for each of our clients, and one of the metrics we track is the number of calls and requests for driving directions coming from the GMB listing. And here are the numbers for one of our sleep clients during a 30-day period. You can see they received 1,600 views, 23 phone calls from their sleep practice GMB listing. And here are a couple others. One received 16 and the other had 40 calls from their sleep listing in that particular month. And important to note, these calls are in addition to any calls that came in from their website. Okay, so these aren't all the calls. These are those that came in just from that GMB listing. And they would not have received those calls if they hadn't established that standalone GMB listing for their sleep practice. And without a separate brand identity for sleep, you can't claim a sleep-specific Google business listing. So while Google is definitely the most important online directory listing, claiming and optimizing other online directory listings plays a big part in being found by potential patients as well. Having a separate sleep brand allows you to create a listing on all of these key directories, and doing so increases your chances of being found online. And in some cases, people search right on that directory website or the app. Other times, that directory feeds data to a search engine or to other apps. So you want to claim and optimize a listing for your sleep practice on all of the leading directories. Okay, another important asset is patient reviews. And in a large, often referenced survey by Bright Local, over 8 out of 10 people said that they trust reviews left on the internet from a complete stranger as much as a recommendation from a family member, neighbor, coworker. And so online reviews weigh heavily in consumers' buying decisions. According to a study by Northwestern University, 82% of consumers will actively seek out negative reviews about a business. We've just been conditioned by sites like Amazon to see what others are saying and to try to find out if there are any issues to be aware of. And one final survey, 48% of patients said that positive reviews would influence them to go to an out-of-network doctor if that out-of-network doctor's reviews were better than the in-network doctor's reviews. So online reviews weigh heavily in patients' choice of medical providers. So if a patient did a Google search for sleep apnea treatment near them and these 3 listings showed up in the local pack, which do you think they'd be most likely to click? Probably Texas Sleep Solutions, right? Why? Because they have a star rating, so the stars catch your eye. Then they notice that their average rating is 4.5 stars, which is a very respectable star rating. Now, a similar search shows a few different practices. Okay, now Texas Sleep Solutions has moved from the number 3 spot to the number 1 spot. So, same question. Which of these 3 do you think a patient is most likely to click? Do you still think it's Texas Sleep Solutions? Maybe not. So what's changed? Simple Sleep Services came into the picture. and they have a slightly better average star rating, and they have 193 reviews versus Texas Sleep Solutions' 8 reviews. Now, in most markets in the country, you do not need 193 reviews for your sleep practice listing in order to really benefit. This is an outlier, an extreme example, but this illustrates the effect that patient reviews can have on a practice's reputation as well as their new patient flow. Okay, then an increasingly important marketing asset for practices today is video content. Cisco, the big technology company, predicted that by 2021, 82% of all internet traffic will be video. And I don't know how accurate that prediction will turn out to be, but if it's anywhere close to that number, the practices with a lot of quality video content are going to have a huge competitive advantage moving forward. Studies have found that having a video on your website can increase conversion rates by 60% or more. And remember, that's the #1 goal of your website, is to convert visitors into scheduled appointments. And people are 4 times more likely to watch a video about a product or service than they are to read about it. And there are several types of videos you can create. You can have meet the doctor, meet the team, what to expect during your consultation type videos. Obviously, patient testimonials are extremely powerful. You can have pre and post appointment videos. For example, this one explaining how to use the home sleep testing unit. And there are more convenient and less expensive alternatives to having a videographer come into your office to shoot the video. For example, we developed a process where our videographer is able to direct the video shoot remotely. We ship everything that's needed out to the office, and then our videographer controls everything from lighting to sound and can even scroll a teleprompter. And then he coaches the doctor through the entire shoot in real time. Then he's able to instantly download the video files so that he can edit them. And this works great for Q&A style videos, as an example, or meet the doctor. And the video quality, as you can see, is hopefully you can see it on this, but the video quality is excellent. So just know that there are alternatives to DIY or full-blown video production in the office. Okay, so once you have steps 1 and 2 in place, you have built out the assets or the brand and the supporting assets, then you're ready to start to accelerate new patient sleep numbers. And so you'll want to add some proactive promotion strategies to the mix to get your message in front of more potential sleep patients. And one low-cost, very effective way to do that is to show up in Google searches organically, or in other words, making it easy for patients to find you without having to pay for advertising or pay each time they click. As we saw earlier, when you do a search on Google, the first page of the results looks like this. So at the top in green are the paid ads. This is often referred to as PPC or pay-per-click. Next is the red box. That's the local pack we looked at. And then right below that and on down the page are the organic listings. I put a black box around those. So this is where organic optimization comes in, okay? Organic traffic comes to your website, or it's when one of your videos or a page of your website or one of your directory listings shows up in the search results, again, without you having to pay for advertising. So in addition to not have to pay for the clicks like you do with advertising, another advantage of organic optimization is even if you stop doing it, stop optimizing, it'll continue to work for you well into the future. It has a residual effect that you don't get with advertising. With advertising, as soon as you stop, you disappear and it's like you never existed. Okay? So let's talk about what it takes to show up in that black box, that organic section. So there are 2 types of organic optimization. First is what happens on the website itself. Okay, so certain things are added to the code of the website, and this is called technical on-page SEO or search engine optimization. Okay, so that's happening on the page. Most of it isn't visible to anyone but Google. Google's reading that code. Most people don't see it. However, there are certain things such as title tags shown here in green and the description tag in yellow that show up when someone does a Google search. Okay, so that's on-page optimization. Then the other type of optimization is called external or off-page optimization. It's happening off of your website. Things like establishing directory listings or getting other websites to point to your website, which is called inbound links. Okay, so and Google's ranking formula is very complex. There are over 200 factors that Google uses when they're determining which websites and videos that they want to list in their search results. And how prominently you show up organically is determined by how closely your website and your other online assets align with what Google is looking for. And the other piece is the competitiveness in your market. That determines how difficult it is and how long it takes to gain significant organic visibility in Google. For example, that search term sleep apnea treatment Chicago has 3.5 million results. So that means that Google has found and associated 3.5 million web pages with that search term. Okay, now note that's web pages, not websites. So, some big sites have hundreds and hundreds of pages, but still 3.5 million web pages that Google has associated with that search term, whereas Dubuque only has 41,500. So significantly less competitive and therefore a much easier and faster process to gain organic positioning in Google if your office is located in Dubuque versus if you were in Chicago. All right. Organic optimization is considered a marathon. It takes consistent effort over a period of time to have significant success, whereas online advertising is considered a sprint. You can achieve almost instant results. However, it's going to be more expensive than organic and requires continually paying for the traffic. As I mentioned earlier, if you stop paying, the traffic immediately stops. Okay? There are several online advertising networks, tons of them with new ones popping up every month it seems, but the largest and most successful of these is Google's advertising platform. It used to be called Google AdWords, now it's simply Google Ads, and the Google advertising network is made up of two primary types of ads. First are search ads, and these are the ads that show up at the top of the search results page that like we saw earlier when someone has typed a search into Google. Okay, so these are people who are actively searching for information for solutions, and they're actively on the hunt. Okay, now you don't pay to show up in this section. You only pay if someone clicks on your ad, and therefore it's referred to as pay per click. You pay for each click. And again, this is an auction-based system, so the more businesses bidding on a search term, the higher the cost for those clicks. So as we saw earlier, sleep apnea gets an average of over 300,000 searches on Google each month. The average cost per click is a little over $2. So so each time someone clicks on an ad tied to that search term, the practice pays somewhere around $2. Okay, CPAP has about a third as many searches each month, and the cost per click is a little higher, $4.28, and then snoring with just over 40,000 searches and an average cost of $1.83. And again, for comparison's sake, dental implants receive about 90,500 searches a month, and the cost per click is over $13. So that says that there are a lot of people, a lot of practices bidding on dental implants, okay, a lot more than are bidding on those sleep-related searches. Okay, so it's so much more cost-effective to run a Google search advertising campaign for apnea-related terms than it is for implants or those other services we looked at earlier. So let's look at some examples of Google search ads. So you could have an ad that you want to show up when someone who knows about sleep apnea typed that term, sleep apnea or sleep apnea solutions, or someone who's trying to figure out why they're always tired. Maybe they typed in something like causes of continual exhaustion, and an ad like this would show up. Or they may have done a search for snoring solutions. Okay? When someone does one of these types of searches, you want to take them, when they click on the ad, you want to take them to a page like this. Okay? That's called message match. The page they land on matches the ad that they clicked on. And this is key to online advertising success. So many practices waste so many advertising dollars by sending all their clicks to the home page of their dental website, or a page that doesn't directly match the ad that potential patient clicked on. Now, if they click an ad for alternative to CPAP, you wouldn't want to take them to that last page we just looked at, okay? Because more than likely, they've already been diagnosed, they've probably tried CPAP and it isn't working for them, or they've just heard horror stories and know that they don't even want to try it. And these are ideal patients for you because you don't have to convince them to get tested. Don't have to worry about a diagnosis or educate them on why they need treatment or the downsides of CPAP. They come in ready to hear all about alternatives. And for those people, someone who clicks an ad like this, you want to take them to a page like this. Okay? It speaks their language. Remember, people have a very short attention span online. And when they land right away, they see, hey, yes, that's me. That's exactly what I'm experiencing, what I'm looking for, what I'm feeling. And then as they scroll down this page, you want to get right into why and how an oral appliance is a viable alternative to CPAP. Okay, so you just get right to it. All right, there's another type of advertising available with Google, and it's called the display network. So unlike Google search, where ads show up when someone has typed in a search term, Google display ads show up on websites when someone hasn't conducted a specific search. Okay, they just happen to be out on a website. So these types of ads are good for creating demand because not everyone would think to do a search for sleep apnea treatment. And not everyone with sleep apnea knows that dentists offer a solution. So display ads can create awareness and generate interest. Google has advertising agreements with over 2 million websites. So your ad could show up to someone within a certain radius of your office who's visiting any one of those websites. So for example, someone near your office could be visiting usatoday.com and your ad could show up like this. Or it could be in a banner at the top of the page, or right in the middle of an article they're reading. And the cost per click is much less with display ads like this than it is with search ads. However, this type of ad is also less likely to result in a phone call, at least right away, because these people weren't actively searching for information or solutions to sleep apnea. This may be the first time they heard about it. So they're not nearly as far along in the process as someone who was active in their search. Okay, so after seeing all the money Google was making with their advertising platform, Facebook created their own, and it too has been extremely successful. In addition to the sheer number of users on Facebook, probably the biggest key to Facebook's advertising success is the level of targeting that's available. Okay, with Facebook, you can put your message in front of the exact subset of Facebook users who are most likely to act on it. On Facebook, you can target by age, gender, relationship status, education level, life events, hobbies, interests, and the list goes on and on. Okay, and you can run campaigns on Facebook using still ads like these or video ads. Video ads on Facebook tend to get much more engagement than still ads. And it's important to note that over 80% of video that's watched on Facebook is watched without sound. So we always add detailed captioning, and that captioning scrolls along the bottom and tells your story without them having to click on the sound button. Okay, there's another aspect to Facebook's advertising that can be effective when it's used properly. Have you ever been researching something online, and then later that day or maybe the next day you're on your Facebook and you see an ad for the exact item you were researching? Same color, same brand, everything. Well, that's called retargeting, and here's how it works on Facebook. If you have the Facebook tracking pixel installed on your website, when someone comes to your website, lands on your website, something called a cookie is dropped onto their web browser. Then later, when they're on their Facebook page, that cookie tells Facebook to deliver your ad right there in their newsfeed. And you can even set it up to customize the ads based on which pages they visited on your website. So very, very targeted, helps you remain top of mind, gets them back into the loop with you. All right, so earlier we talked about creating video content and the growing importance of video, but simply having high quality informational videos isn't enough to move the needle. You must have a strategy for promoting your videos. So often we see practices who have created video and then they don't properly optimize it. And they end up getting few or in some cases no views and therefore no value from the video. So, we see this all the time. So searching for on YouTube for Sleep Apnea Atlanta, I came across these two videos, and as you can see, the first one only has 14 views, and it was uploaded 2 years ago. The second had no views in the 3 weeks since it was uploaded. Creating video and not optimizing it is basically the equivalent of paying to have a TV commercial created and then not buying any airtime to run the commercial. It's not going to do you any good. Okay, when you have good quality video content, there are so many ways you can leverage it. You can use it on your website, up at the top of the page, or somewhere in the home page. You can have it on the Meet the Doctor page, your services pages. It can be you explaining a treatment option or a patient talking about their experience at your office with that particular service. You can use them on social media, either as an organic post or as an ad. When you have informative and engaging videos properly used on social media and other online channels, you can get a lot of comments, likes, shares, and just generally generate a lot of activity for your practice. Directories, in addition to, as we saw with the Google Business GMB listing, several other online directories allow you to upload video as well, making your listing more engaging, more likely to be clicked on. Digital ads on YouTube or Facebook. Video ads tend to get much better results than still ads. You can have pre and post appointment videos, information, education, what to expect, next steps, answering commonly asked questions, etc. And then this is a big one. You want to make sure that you optimize them organically on YouTube so that they show up not only in YouTube searches, but those videos, as I said earlier, will also often show up in Google searches as well, giving you that added benefit. So this is the video we looked at on the prior slide that only had 14 views in 2 years. Running it through some video optimization software we use, you'll notice it's poorly optimized on YouTube, scoring just an 11 out of a possible 100 overall, and then 17 out of a possible 100 for SEO. It wasn't shared on social media, it doesn't have tags, and it's missing several other optimization factors. And most people simply don't know how to optimize a video. So this is an area that offers a lot of upside potential for progressive practices that do it right. Properly optimized video content can have a big impact on your online presence and your new patient flow. This is Google Analytics data from a client of ours that compares their sleep website traffic in the 3 months before and the 3 months after we ran a video marketing campaign for them. And as you can see, in the 3 months after the campaign launched, their website visitors were up 48% from 927 visitors to 1,385 visitors. So an additional 458 prospective sleep patients came to their website in 3 months. That's significant. That's going to move the needle. Okay, and this illustrates the power of a well-done, properly optimized video. And I love analytics and data like this because, as they say, the numbers don't lie. We don't have to guess. Is that working? Is it not? What was the effect? We can see it, in black and white. So I hope this has helped you visualize how having a comprehensive, proactive, direct-to-patient marketing plan and a standalone sleep brand can be a game changer for your sleep practice. We've talked to a lot of practices that are just getting started with sleep, and they're not at the point where they want to start spending big money to drive traffic, but they do want to establish a sleep brand and an online presence. So based on the feedback and requests, we created a turnkey sleep branding package. It includes a website, helping you select a name for your practice, designing a logo, building out a website, including optimizing the website for Google search, hosting it and maintaining the website, creating a branded Facebook page, as well as a branded and optimized YouTube channel. And it is, without question, the easiest, most cost-effective way possible to establish a comprehensive, professionally designed sleep brand. So, again, if you'd like to schedule a call with me, you can do that by clicking on the blue button on the homepage of dentalsleepmarketing.com. And from there, you can select a time on my calendar that works for your schedule. We can discuss your market, brainstorm ideas, talk about different ways to approach your market and reach your goals with your sleep practice. And I'll leave you with this thought before we get into some Q&A. Sleep apnea is truly an epidemic, and there are not anywhere close to enough sleep physicians or sleep labs to handle the demand for treatment. Some of these sleep labs are booked out months. So you, as a dentist, are the best positioned healthcare professional to screen and to treat these patients, especially those who are CPAP intolerant. And as we talked about earlier, that's the majority of people. So I encourage you to take advantage of this opportunity to help people, ultimately saving lives, and in the process build a very lucrative sleep practice. So I thank you for your time, and I think we might have a few minutes for some questions.
Well, first of all, I'd like to thank you very much, Mark. Excellent presentation. I really enjoyed it. And I just want to remind everyone while we're waiting for questions that this has been taped. We do have this entire webinar that's going to be up on the whipmix.com website, and then it's also in our YouTube channel. So that'll be there. It usually takes about a day or so. So just keep checking either whipmix.com in the webinar section or our YouTube channel, and you'll be able to rewatch it to answer questions or to have other people in your offices or laboratories who didn't have an opportunity to see it, to give them that opportunity. The other thing is, for those of you who do require some recertification credit, if you're a CDT or a dentist, we do provide that. It is 1 hour of CE credit that will, again, take about 24 hours. But we will contact everyone who's signed up for this program, and we'll tell you exactly how it is. I will mention that there's a few questions. It's very simple. We keep it true and false. So if you were paying attention, I'm sure you'll have no problem receiving the credit. And we will then send a certificate, which we then turn into either ADA CERP or the CDT program. So anyway, we do not have any questions up on the board, which is a little surprising. You either did an amazing job explaining everything, Mark, or people are just shy. I'm not sure why that is.
Okay.
If there are no questions, as Mark mentioned, dentalsleepmarketing.com is the place to go to talk further with him about the subject, and I'm sure he'll be able to answer any questions that you might have. So unless we get any in the next few seconds, no, it's not a question. You did a great job. It's a comment.
Thank you.
You did a great job, and I agree with that. That was a terrific presentation. We don't have any. Well, I guess that's lucky. Please don't hesitate to go to the website, dentalsleepmarketing.com. And I'm sure all your the questions that you wished you had asked at this moment, you'll be able to talk to Mark about. All right.
Perfect.
Well, then, if that's that, thank you for joining us, and look forward to seeing you at another WhipMix webinar. We hold these every other Tuesday at 11 a.m. Thank you. And Mark, thank you very much for a great presentation, and I'll be in touch with you soon.
Okay.
Okay?
Thank you, Bernie. Thank you, everyone. Take care.
Bye-bye.